Hi there, Sue Knuffler, Chief Nursing Officer at Huntington Hospital. Welcome back. Today is June 3rd, and I'm wearing orange today to express my solidarity for National Gun Violence Awareness Day. Unfortunately, we have witnessed more gun violence. One at a supermarket in Buffalo where 10 people were killed, 3 were injured. Then at a hospital campus in Tulsa, Oklahoma, where 5 people were killed and multiple others injured. Believe it or not, this was the 233rd mass shooting in the U.S. this year alone. Closer to home, within our four walls, we've witnessed some violent patients and at times visitors in our ED and in other parts of our hospital. So today, I think it's an important time for us to share steps that we've already taken and the work that's underway. Number 1, we have a workplace violence committee teamed up with leadership from education and from security. Recently at our administrative meeting, we had Michael Scarpelli. He's the executive director of Zucker Hillside and South Oaks. And he came to us to talk about recent trends in behavioral health, what's happening, what needs to be done, different models of care, how the numbers are on the rise, and different things that we're putting into place. Number 3, Patrick Ilnitsky has looked into something involved panic buttons. This will be distributed to the 5 North staff for a quicker, immediate response to any sort of violence or if they anticipate something. We're looking at cohorting behavioral health patients. Maybe they should go into a certain section of the hospital, meaning those that are medical, surgical, or telemetry. Maybe we should house them together and pool our resources. It's a thought. Our 5 North behavioral staff will begin rounding on patients that are on other units and do an assessment and do a check-in with that nurse as to any signs or signals regarding those patients. We're going to have a grand rounds education opportunity. Dr. Sarsavec is going to do a presentation for us on signs to look for, ways to de-escalate for all of those who have not received in-depth training on behavioral health patients. There's a metal detector at Long Island Jewish that they're piloting, so anyone that enters the hospital with a gun or potentially a knife, it's picked up at that point. We're going to allow them to test it and operationalize that, and then that will be rolled out throughout the health system. We will have more de-escalation classes. We will have more active shooter training. You can at this point contact Patrick Ilnitsky or anyone from security and they'll come up to your units to do a training exercise. We're looking to put a teletracking indicator, some sort of a marker that would indicate whether that patient has a tendency for violence. We're also looking at the banner in Sunrise, whether there can be an indication there of a V code to indicate that the patient has had either a past history or current signs of any kind of potential aggression. And lastly, just remember to always call 2600 if you are in any way in danger or there's a need of an emergency. Now, I just want to emphasize that we are worried about you. We had a recent event where one of our nurses had an interaction with a patient where the patient became aggressive. We know that these acts of violence bring about stress, fear, and anxiety. We acted immediately in this case. I spoke to the nurse the night of the event. I know Dr. Fitterman spoke to the nurse the next morning. Security was present up on the unit. We will do everything we can to activate and make sure to ensure your safety. So I just wanted to go over all of these actions that are being put into place to show that we are activating things so as to minimize and mitigate and potentially avoid any further risk of harm to anyone. If you have any questions or you want further discussion, please feel free to contact me. Thanks for listening. Stay well.